Okay guys, this is our last video on renal dysfunction. So we're going to start off by talking about glomerular nephritis. Before we do that, we want to talk about the glomerulus. Remember, the glomerulus is part of the nephron. When someone has glomerular nephritis, it means that you have inflammation of the glomerulus. So we want to break down what the glomerulus does so we can understand why the outcomes of glomerular nephritis are what they are. So remember, the glomerulus is part of your nephron. It takes care of bulk filtration of blood, so that after blood passes through the glomerulus, the fluid then becomes filtrate, and then that filtrate moves into the rest of the nephron tubule, where we can be selective about what is reabsorbed versus secreted, okay? When someone has glomerular nephritis, obviously then the function of the glomerulus is going to be diminished because it's inflamed, okay? So there is a form of glomerular nephritis that is associated with lupus, which we'll get to in a few minutes, but can also be caused by ischemia, diabetes, exposure to certain toxins, and vascular disorders. So all right, what are some of the outcomes when someone has glomerular nephritis? So we have to think about what's happening at the level of the glomerulus, and then what would be kind of potentially left behind or would not be properly filtered out because of that area of the glomerulus takes care of a lot of our initial filtration of blood before it becomes filtrate. So the outcomes would be a decrease in GFR. GFR stands for glomerular filtration rate. And this is the rate of filtration through all of the glomeruli in each of your kidneys. That would go down, obviously. If you have swelling in and around the glomerulus that you're not going to be able to filter fluid through at the same rate you would in a healthy glomerulus. Okay, you would have proteinuria, which means you have protein in your urine. Okay. Should you have protein in urine? No. Protein is a nutrient. It's something we can use in a building block of all kinds of tissues and cells, and so there's no reason that we would want it going out in our urine stream as a waste product, okay? We would have blood in the urine. Now, this one's a little tricky. You could have blood in your urine for any number of reasons, okay? You can also have the protein albumin in your urine stream because of hypertension. So again, these things aren't really unique to this particular disorder. Okay, so if we think about how small these are, I mean, the nephron tubule is only about 1.25 inches big. So these are not large structures. So what can we use to assess a drop off in glomerular filtration rate? All right, so how do we do this? How do we assess it? So if we think about some of the things we were talking about before, when I said that your kidneys do a good job of getting rid of things like urea, for example, right? If glomerular filtration rate has declined, then perhaps you're not getting rid of the appropriate amount of urea. So we can assess this by looking at our plasma level of urea. It would increase if glomerular filtration rate goes down. Okay. The other thing that would change is the level of creatinine. So again, this would increase in your plasma. Okay, what is this? This is a waste product. It's a breakdown of creatine phosphate from muscle protein metabolism. And because normally this would be filtered out, it would not be at high levels in your plasma, but will be filtered out through your kidneys and then connects it as urine. So if this goes down, these two markers would go up. So you can look at those two as in the plasma as indicators of how slow filtration rate is through the glomeruli. You would also have edema, fluid retention. Again, your kidneys are important for osmoregulation. If they're not able to do the appropriate amount of regulation of fluid balance, then you're going to have an increase in the retention of sodium and water, and you would have profound edema. Okay, treatment would have to address what the cause is, for example. So let's say it was something infectious that was causing the inflammation, then we would treat with antibiotics. Another mechanism for treating this is to try to get at the inflammation. So you could do that using corticosteroids. But as we discussed, administering corticosteroids has its own challenges because corticosteroids have extensive amount of side effects, but they're good at reducing inflammation. And then any symptom-specific treatments. So, for example, you might be able to give diuretics, for example, that would allow for some loss of fluid, might be able to get at some of that edema. Okay. Some specialized causes of nephron damage, as I mentioned, would be diabetic nephronopathy and lupus nephritis. Can be extensive to the point that it can cause kidney failure, which we're going to talk about now. And so let's launch right into that. So renal failure. Okay, one of the issues associated with renal failure is high blood pressure. Okay, as I mentioned before, if someone has uncontrolled hypertension, it can contribute to renal failure. Now, you can also have nephronopathy or nephritis associated with things like diabetes and lupus that can contribute to renal failure as well. Okay, so how do we assess? Diagnose how bad and how extensive renal failure is. How do we do it? So again, we're going to use plasma-borne markers. So we're going to look at plasma levels of urea, if they are elevated, and plasma nitrogen levels. If these are elevated, the extent of their elevation can give us an indicator of how bad the kidneys are failing. At what stage of kidney failure are we? Okay. All right, so kidney failure can be assessed using an acronym called RIFLE. Okay, so what does this stand for? Risk, injury, failure, loss, and end-stage kidney disease. What this can tell us, where on the spectrum is your patient? How compromised are their kidneys? Are you at risk for kidney damage, or have the kidneys already begun to fail? Okay. We can look at things like how decreased filtration pressure really is. And if we're not pushing blood through the kidneys under the correct pressure, through the glomerulus and through the nephron, then obviously you're not driving the production of enough filtrate. And then if you're not driving the production of enough filtrate and not being then selective about what stays and what goes, some of the things that should be filtered out of your bloodstream will not be filtered out of the bloodstream. So, what can we do for kidney failure? Unfortunately, when someone is in end-stage kidney disease, with a chronic issue especially, then we have to manage kind of the symptoms that would be associated with that. So some of the symptoms that would have to be managed associated with kidney failure. All right, so if we're going to try to manage our symptoms, we have to, again, think about all the things that the kidneys are doing. So we have to manage our electrolyte imbalances. We're going to have to look at sodium. We're going to have to look at potassium. You're going to have to manage blood pressure because, again, the kidneys play such a big role in blood pressure regulation, fluid balance. Okay, we have to minimize the amount of edema. Again, you don't want to have fluid buildup in the lungs, okay? And then we want to help to prevent any infections. We don't want to be in a more pro-inflammatory state than you already are. Okay, the treatment that we can use when someone has failure of the kidneys then is you would use dialysis. All right, so what dialysis basically means is you're going to remove blood. You're going to send it through a machine that has a specialized type of tubing inside, dialysis tubing, where some things, depending on the size of the hole in the tubing, will pass through the tubing very easily and some things will not, right? The things that are not can be put right back into the patient's bloodstream, but the things that would filter out would be the things that would be small enough to pass through the dialysis tubing, which is what you want. You want the things that you don't want returning to the bloodstream to be filtered out. So there's some issues, of course, associated with having dialysis, not the least of which is you have to have dialysis fairly often. It's not something you do once a week, but it's several days a week. So you have to be near a dialysis center. Obviously, there's issues with veins collapsing and not finding appropriate entry points to insert the needle to do the dialysis, and then the time issue. It takes time for it to occur. What the person really needs is a new kidney, which again creates its own challenges. You have to make sure the person's an appropriate match. We have to worry about rejection downstream. When someone has a chronic kidney disease, not necessarily, they might be at risk or at the beginning stages of failure. Some of the things you would need to do would be to limit certain items in the diet. For example, you'd want to limit the amount of protein in the diet because obviously if you need to break down that protein and clear all that nitrogenous waste, if we can cut back on the level of protein, that's going to help an already challenged system. And then we'd want to watch the levels of sodium and potassium to make sure that then we don't have to manage extensively electrolyte imbalances downstream, okay? If hypertension is the cause, we want to make sure that we're managing the hypertension associated with the kidneys failing. You want to make sure that you give vitamin D. You want to make sure that you are giving erythropoietin, because remember, the kidneys are in charge of releasing erythropoietin. You want to make sure that you're giving it at the appropriate level. Erythropoietin is a hormone that's released from the kidneys. And then what it does is it will stimulate the bone marrow. And when it stimulates the bone marrow, you will produce red blood cells. Someone whose kidneys are not responding appropriately, you might have to give them supplemental erythropoietin to make sure that this process is intact and that their red blood cell level is appropriate. And obviously you could assess whether or not the red blood cell level is appropriate by doing a count of the red blood cells when you're doing CBC. Okay, that's going to do it for kidney failure. And that's going to do it for renal dysfunction. The next set of videos is going to cover respiratory dysfunction.